Hello, this is Dallin from the Hardy Nutritional Science team, and today I want to talk to you about managing medication potentiation. And I've got some notes with me, so I'll be looking down occasionally just so I don't forget anything and I present things clearly. So first of all, I want to discuss what is potentiation. So the definition to potentiate is to amplify or magnify or strengthen. So when a medication is potentiated, so medication potentiation would be then that medication is strengthened or amplified its action, right? And why is this relevant to Hardy Nutritionals? Well, there is a specific type of nutrient-drug interaction. Nutrients and drugs can interact in the body that amplifies or potentiates the effects of certain drugs. And this occurs between the Daily Essential Nutrients product of Hardy Nutritionals and basically any drug that affects the nervous system, so psychotropic substances, so that's all the psychiatric medications and many others, including some indirectly affecting ones that like thyroid function, thyroid drugs. Anyway, it's consistently reported, potentiation of many medications is consistently reported by clinicians and their patients alike. So it's documented by clinicians in published professional communications, the clinicians that use our products, Daily Essential Nutrients specifically in their practice, and it's commonly reported to our customer service team. Customers will call in wondering what they're feeling and some questioning. We learn that they're on medications, and we say, hey, have you ever looked at the side effects of those medications? Considered that this interaction could be happening, and it turns out that the explanation for what they're experiencing is that Daily Essential Nutrients is potentiating the drug, magnifying its action in the body, amplifying its effects, and that has certain implications. So let's understanding potentiation. Let's try and understand potentiation. Consider this. If the action of a drug is potentiated, right, by Daily Essential Nutrients or any other substance or treatment, would you then need more of the drug or less of it? Well, I've already gone over the definition of potentiation. So by definition, basically, you get the same effect from a lower dose. So you need less of it, right? What does potentiation mean clinically? For treatment effects, it's really good. So the treatment effect of a drug is the desirable benefits you want from it. For the side effects of the drug, it could be bad if you potentiate those, right? What if you potentiate both? This is really the reality. You take because side effects and treatment effects, they're all just effects of the drug. And we call them side effects because we don't like them. We call them treatment effects because those are the ones we're looking for. But they're really just effects of the substance in the body. And if the action of that substance is potentiated, then often both will be potentiated. So the reality is when you potentiate the drug, is it good or bad? Well, it's neither. If both the treatment effects and the side effects are potentiated, then you really have the same situation that you have with a non-potentiated drug. You just, there's pros and cons, there's good and bad, there's treatment effects and there's side effects. So is this really crazy, something unique to Daily Essential Nutrients? No, it's really not. This is to be expected. So there's a lot of studies of single nutrients, mostly, that are added to psychiatric medication, for example. I've reviewed some studies with folate. They add folate, one nutrient, to psychiatric medication. That psychiatric medication has already been independently studied, and so has folate. And they combine them together, and they get treatment effects that are distinct from just the drug by itself, right? So just one nutrient can change can augment the drug treatment. Now consider Daily Essential Nutrients. It's therapeutically high doses of multiple nutrients, okay, known to be essential for proper biological function. How could it not affect the way the drug acts in the body? So it's really to be expected, and especially in cases where Daily Essential Nutrients has been extensively researched, and there's research of showing efficacy for certain, symptoms that those drugs also affect. So there's proven efficacy for symptoms also affected by the medications. Potentiation is not, it's expected. It's not cuckoo, it's not weird, it's not unusual. It's to be expected in a situation like this. Now, why haven't you heard of it before? Why isn't it commonly talked about? Why don't clinicians, always worry about this thing? Well, one of the reasons is formal clinical research of nutrient. There are many other reasons perhaps, but formal clinical research of nutrient-drug interactions is really limited. I've talked about, adding one nutrient to a drug. Stuff like that is known, but something more comprehensive like daily essential nutrients, these studies are more difficult, they're more expensive. It's easier to just take one treatment and use it, and then combine two together. Ethics can be confusing, when they try to run a study, they have to approve the study with a board that reviews how ethical it is, and stuff like this can just make studying things more difficult. So take-home message here is, for me as a scientist going to graduate school and doing some research myself, just because there's not a scientific study for a phenomenon, it doesn't mean it doesn't exist, okay? There are a lot of things that really happen in the real world that haven't been researched or haven't been at least adequately characterized in a scientific way, and in a way that, a controlled trial. That is definitely true. So don't dismiss something just because you haven't seen a study on it.